Okay, everybody, this video is to help explain how we're taking the concept map further to do interventions and rationales. So first off, in the email, I said that we would talk about the medication sheet, and there is a blank medication sheet attached to the email. So and the student should be able to find that in Blackboard, no problem. So I have my students do medication sheets when they are administering medications. I tell them that they can go ahead and do this on the computer and save it because they could use this medication form in Adult Health 1, Adult Health 2, or whatever, and more than likely they're probably going to give some of the same meds. So you can pass that little tip along, okay? I just wanted to show you kind of what one looks like. Please remember they have not had pharmacology yet, so they're going to have to be using the resources to do this, and so they might not really be able to connect the dots yet. So don't hold them too high to that, but we do want them to know enough so that they are safe administering this medication. So the blank, like I said, the blank medication sheet is attached to the email, but here is just kind of what we're looking for, okay? So they need to have the medication name and dose, frequency, route, time of administration, and the classification, what the action of the medication, the rationale for it. Why is that patient receiving it? Certain things that I see here is like if this is aspirin, they're getting 81 milligrams, and they'll put the reason is for pain relief here. So that's a good teaching point for them that medications can be used for different things. Common side effects, so they can put their common side effects here, and then later they can go back and underline any that the patient may actually be experiencing. Nursing implications, so anything that well, you know what a nursing implication is. And for some reason, I'm sorry, this one doesn't have the last box. It must be on the back side of the PDF. And that is the evaluation. So this whole sheet should come filled out prior to clinical, and then after they administer the medication, there is another box right here that you'll see on your blank form that says evaluation, and we actually want them to evaluate the effect of that medication and how it happened with that patient. So, if it's a vitamin, obviously that's a long-term evaluation and cannot be evaluated during clinical. But, if it's a pain medication, they should be able to say what the pain level, what the pain assessment was prior to the medication, as well as what it was 30 minutes to an hour later. Same thing for blood pressure medication and so on, okay? So I apologize for that not being down here, but you'll see it in the blank form, and there is actually on the evaluation form that we're filling out every single week with the satisfactory, needs improvement, unsatisfactory. There's a place that says if they evaluated their meds. So just be sure that they are filling that part out. And I do, the first time they give meds, I sometimes do actually help them with that evaluation because they sometimes don't really know what to put there. Okay, so that's the medication sheet. Okay, let's see here. Let's go to the goals and outcomes. So I did not prepare a case study this week just because I don't necessarily think that we need it, but I'm sorry, I'm looking now for where I put, oh, it's down here, sorry. But I did go ahead and do this, and I'm sorry the formatting is off a little bit, but you'll get the idea. So we can just start off in our post-conference and say that the #1 nursing diagnosis for this patient was risk for ineffective tissue perfusion related to vascular trauma from surgery. And here is the patient's overall goal and outcome statements. And so now we're going to go down to nursing interventions. And so if you refer to the nursing process PowerPoint that Dee Dee does with them, as well as I sent it to you. It explains what the nursing interventions are, but just know that the nursing interventions need to include all pertinent interventions related to the nursing diagnosis. They need to be very specific. So if our students go and use a concept map, they'll get vague nursing interventions, but they need to be sure that they're customizing it. So we need to be able, for instance, you go, assess skin temperature and color every 4 hours during shift. So you need to be able to state exactly what you're doing and how often it's going to be done or when it's going to be done. Okay, so I teach, my students to put patient will for the overall goal and outcome, and they can either write it or just think it in their head that nursing interventions will be nurse will. So this should list everything that they can think of that would help meet this goal, okay? And so what you're going to see is you're going to see that they just start adding interventions, and it might not actually be related to that goal and outcome. So that is a very good teaching point for the students, okay? So I recommend that in post-conference, you discuss that make sure that every time they think of a nursing intervention and write a nursing intervention, that they actually go back and make sure that that is going to help meet this goal. Okay, so those are nursing interventions, and then they need to, in this box, it's just the rationale. So why is the intervention needed, important to meet this goal? They can use their nursing diagnosis book or concept map books if they like. We did not make this something that needed to be cited, like they needed to actually have a reference for it, because I wanted them to think, and I wanted them to be able to tell me, why do you think that, why would we assess skin temperature and color every 4 hours during my shift in order to maintain adequate tissue perfusion? And the rationale for that is that injured tissues are usually cooler than the non-operative side, and so on. So I want them to, like I said, it can be cited, it can be from a book, or they can just state it in their own words, okay? And that's as far as we're going this week. Mine looked pretty decent, and I really do think it's because, we did a practice one beforehand, and then we started talking about their own. So I hope that makes sense to you. Just to review, we're going to do one priority nursing diagnosis. They're going to write a goal outcome statement for that priority nursing diagnosis. And this week we are going to add nursing interventions and rationales. So they are not doing evaluation here, and then I took it off down here, but they are not doing an evaluation here, okay? So I hope that helps. If you have any questions throughout the week, please just let me know. Thanks, guys.